Let me guess, the pinching pain in the groin probably didn't start overnight. It started as a tiny feeling in the groin when you bent down to put your socks on, and then you noticed it when you were standing up and trying to take the first steps. Then climbing stairs, lifting your foot up on a step, and eventually, even sitting started irritating it. The aching pain starts showing up more and more in your daily life. When the groin hurts and feels tight, most people try to stretch their hip flexors thinking that that's the actual problem there. Or they do a few mobility exercises like cars or, hip openers. They might foam roll or massage the area. And those things might even feel pretty good at first, but the pain always returns and starts getting worse. And then you find yourself in a stretch pain cycle, or what I call a pain management cycle. But what if the growing pain and the hip flexor tightness is trying to tell you something else is off in your body? Like something else is actually going on. In this video, I'm gonna show you what is the actual cause for the pinching groin pain, why stretching does not work, and what you need to focus on to get lasting relief. See, inside your hip joint, the femur, the hip bone, is supposed to stay sort of centered inside the socket and then have the ability to glide in the socket when you walk and squat, climb stairs, or lift your leg up. But when the deeper stabilizing muscles around the hip aren't doing their job correctly, they may tighten up and start pushing the femur forward in the socket. And that is what creates the pinch at the front of the hip. Another driver is your pelvis position. So if your pelvis is in an anterior tilt, due to its position, the hip bone can hit the front part of the socket faster when you bend over or you pull your knee up to your chest, which causes that pinching sensation. And sometimes the femur is already rotated kind of in. When you ask certain movements like squatting, sitting, your femur simply can't rotate much further forward and it jams against the bony structures. This doesn't happen because the hip flexors are too tight, but because the femur is sitting in a position or your pelvis is tilted in a way that it simply pinches the bones together. Now, here's why stretching feels good temporarily. The hip flexor muscles often get tensed because they are actually holding and supporting the femur, your hip bone, in place. That might make them feel like they need to be stretched. But when you stretch the hip flexors, you temporarily reduce the tension at the front of the hip joint. You unload the front of the joint for a moment, and that is why the pinch may ease up for just a short time. But the second you go back walking, standing stairs exercises, or just sitting again, your body faces the reality of an alignment issue, poor stability, and limited loading capacity, and you get that pinch back. The stretch kind of changed the sensation temporarily, but it did not change the root cause of the pain. And this is exactly why so many women feel trapped in this kind of stretch pain cycle, and no one seems to explain this to them. Another problem with stretching is that you can actually make the situation worse by stretching the very muscle, your hip flexors, that is just trying to do their best to stabilize the joint. And this creates even deeper cycle, and some women might actually feel worse after doing much of stretching. If this is landing and you want to go deeper on how hip positioning affects chronic pain, subscribe so you don't miss the next videos. And if you want to see how I help my clients to get back walking without limping, without feeling that awful pinching in the groin, watch my free webinar. You can find the link in the description below. Here is what I want you to know. The problem is hardly ever about muscle length or tightness or lack of flexibility. Most of the women I work with are actually slightly too flexible. Their ligament laxity is often just naturally higher, and they are flexible all over but in their hip joint. They often even say things like, I used to be so flexible and now I can't even reach down to my feet. They try all the stretching routines, but of course that doesn't change their pain, because if the flexibility was the issue, it should have been working already. So let me ask you a few questions. Does your groin pinch feel better after stretching? Does your groin pinch feel better after stretching but then return later the same day? Does walking, stairs, lunges, squats, knee to the chest bring the pinch back? Have you been stretching consistently for weeks or months without lasting relief? Does the pinch get worse after certain exercises like glute bridges? And if you answered yes to those, that's a huge clue. These are the signs that your hip problem is not a flexibility issue, but rather a joint positioning issue. And that changes everything about how the issue should be treated, because now the focus is no longer how do I stretch this more, because it doesn't work. Now the question becomes, how do I improve the positioning and stability of the hip joint? And this is where most rehab approaches completely kind of miss the mark. Instead of restoring the pelvis mobility and the glide of the femur, they keep pulling on tissues that are already struggling to stabilize the joint. Or even worse, they guide people to work their glutes, which will directly increase the tension in the deep groin rotators and block the femur movement even further. Shovel the femur further forward. It's already there. Sometimes my clients have been told that they are, for example, in an anterior tilt, but no one tells them what they can do to support and stabilize their pelvis. And I've been there too. As a PT, I used to treat my pinching hip pain in the same way. I mean, bad mistake. My pinching moved from being just occasional to an aching groin pain in sitting and even at night. I used to limp the first few steps before the hip sort of warmed up. It all started to improve fairly quickly when I figured out that instead of focusing on the front of the hip, I just needed to change what was going on the back of the hip and the pelvis. So what actually needs to happen is that the pelvis needs to be stabilized at first. The deep hip rotators get a little tight and tensed when the bigger stabilizing muscles like glute max, glute medius, hamstrings, or abdominals won't do their job. See, body will find stability by gripping and tensing muscles. That is when the deep hip rotators start overworking. Next step is to restore the proper length of the deeper stabilizing muscles so that the femur is not constantly shoveled and pushed forward in the socket, and it can glide back or glide in general during the movement. And that is how we get more range of motion without pinching. Once we have a stable position and enough length and mobility in the right muscles, then we can build muscle strength in the bigger muscles like the glute max and medius, abdominals and hamstrings to stabilize the pelvis. Building strength on the top of an alignment issue just simply doesn't work. Now, I have to say that women are always shocked when they realize this, because suddenly the relief starts lasting longer. The hip feels more stable and supportive. Walking becomes smoother, and eventually they stop constantly manage the pinch altogether. Now, let me show you a really simple test you can try at home. So before you stretch tomorrow or tonight, do this first. So sit down in a chair with your feet flat on the floor. Now pull the knee on the painful side towards your chest using your hands. Notice exactly when the pinch starts. Now repeat the movement again, but this time, once you get close to the pinch, use your hands sort of gently guide and push the femur, push your knee back or knee in. So we're pushing the femur back in the socket, and just notice what happens. Does the pinch decrease? Does it happen later? Does the movement feel smoother? Do you suddenly feel more stretch in the buttock? instead of pinching in the front. Because if changing the femur position changes the symptom, that is what we need to focus on. Another test is to sit in the same position, keeping the sit bones level on the chair, and then pull your knee up again. Once you feel the pinch, tuck your pelvis under and lift the pubic bone towards your chest. Does that pelvis position change the pinch? If it does, the problem might be that your pelvis is more in an anterior tilt. That is when stretching is just not effective anymore, but restoring alignment is. It means that positioning is influencing the pain. And sometimes neither one of these tests provoke the pain because the reason for your pain can be totally something else. This is exactly why random exercises and stretches hardly ever work for chronic hip pain. They are just not addressing the actual reason why your body is active. And in those situations, aggressively stretching or strengthening the hip can actually make the stability and alignment problem worse. The muscles in the front may already be trying to help to stabilize the poor position joint. So if we just keep stretching them over and over again without fixing the mechanics, we keep sort of disarming the system that is just trying to protect the hip joint. The real solution is restoring the alignment, improving your pelvis positioning, improving deep hip stability, and gradually teaching the hip to tolerate load properly again. And once this happens, the pinch and the ache stops running your life. If this video helped you to understand your hip and hip pain differently, make sure to subscribe because I talk about this stuff every single week. And in the next video, I'm going to show you why some glute exercises actually make groin pinching worse and what to do instead.